Alzheimer's disease (AD) is a neurodegenerative condition that progresses over decades. Early detection of individuals at high risk of future progression toward AD is likely to be of critical significance for the successful treatment and or prevention of this devastating disease. A Cornell-led collaboration used machine learning to pinpoint the most accurate means and timelines for anticipating the advancement of Alzheimer's disease in people who are either cognitively normal or experiencing mild cognitive impairment. The modeling showed that predicting the future decline into dementia for individuals with mild cognitive impairment is easier and more accurate than it is for cognitively normal or asymptomatic individuals. At the same time, the researchers found that the predictions for cognitively normal subjects is less accurate for longer time horizons, but for individuals with mild cognitive impairment, the opposite is true. The modeling also demonstrated that magnetic resonance imaging (MRI) is a useful prognostic tool for people in both stages, whereas tools that track molecular biomarkers such as positron emission tomography (PET) scans are more useful for people experiencing mild cognitive impairment. The team's paper, Machine Learning-Based Multimodal Prediction of Future Decline Toward Alzheimer's Disease, an Empirical Study, is published in the journal PLOS 1. Alzheimer's disease can take years, sometimes decades, to progress before a person exhibits symptoms. Once diagnosed, some individuals decline rapidly, but others can live with mild symptoms for years, which makes forecasting the rate of the disease's advancement a challenge. The researcher explains that when we can confidently say someone has dementia, it is too late. A lot of damage has already happened to the brain and it is irreversible damage. We really need to be able to catch Alzheimer's disease early on and be able to tell who is going to progress fast and who is going to progress slower so that we can stratify the different risk groups and be able to deploy whatever treatment options we have. Clinicians often focus on a single time horizon, usually 3 or 5 years, to predict Alzheimer's progression in a patient. The time frame can seem arbitrary. The researchers use neural network machine learning that could analyze 5 years worth of data about individuals who were either cognitively normal or had mild cognitive impairment. The data captured in a study by the Alzheimer's Disease Neuroimaging Initiative encompassed everything from an individual's genetic history to PET and MRI scans. The researchers discovered several notable patterns. For example, predicting a person will move from being asymptomatic to exhibiting mild symptoms is much easier for a time horizon of 1 year compared to 5 years. However, predicting if someone will decline from mild cognitive impairment into Alzheimer's dementia is most accurate on a longer timeline, with the sweet spot being about 4 years. Regarding the effectiveness of different types of data, the modeling showed that MRI scans are most informative for asymptomatic cases and are particularly helpful for predicting if someone is going to develop symptoms over the next 3 years, but less helpful for forecasting for people with mild cognitive impairment. Once a patient has developed mild cognitive impairment, PET scans, which measures certain molecular markers such as the proteins amyloid and tau, appear to be more effective. One advantage of the machine learning approach is that neural networks are flexible enough that they can function despite missing data, such as patients who may have skipped an MRI or PET scan. In future work, the researcher plans to modify the modeling further so that it can process complete imaging or genomic data rather than just summary measurements to harvest more information that will boost predictive accuracy.